all the hormones too, with the estrogens and whatnot. So when we take a woman with hot flashes, she's going to need some form of estrogen, usually estradiol, E2. If we put estradiol on her, it should strengthen governing vessel 20, no matter what, and it should fix circulation sex 1, right? Well, if we find all the remedies that we think balances out circulation sex 1, and then we put estradiol back on, and it no longer strengthens in any way, we've just proven, cross-checked, that we've got the right remedy to not only fix the problem, but the body no longer wants that hormone. That's perfect. That's exactly what we're looking for. So it'll make a lot more sense when I do it on the table. You're visualizing it now. But when we see it on the table, you go, oh, I see what you're saying now. Anybody have lightheadedness, shakiness if they miss a meal, irritability if they throw things at their spouse? If they, Kate, you do? I thought you were perfect. I thought we had you perfect.
No,
not yet?
Right now, I think because of the...
Oh, right now you do, maybe? Okay. Why don't you come on up and we'll do all the soft tissue tests with you, and then we'll see if we can elicit a blood sugar problem, even if spleen 21 doesn't show up as the primary point. You'd be willing to come up? Let's just see how her alignment looks down here. She takes really good care of herself, does a lot of good things. You don't even eat wheat anymore, right?
On occasion only.
On occasion only. She's one of those people that annoys you because she does everything right, you know? You don't want to tell her all the stuff you do behind the scenes. Yeah.
I listen to my doctor.
I always feel bad when people come in and say, Dr. Monk, you must have a perfect diet. I say, yeah. That's a nice sweater you're wearing. Bend your leg here. Let's check some of our muscles, our basic 5. So she's a little short on her right leg. Remember, the side of the short leg is usually the side you might find the weak sartorius on. So let's see how she's doing with her sartorius. She actually does have a little bit of a weak sartorius. Small intestine is rectus femoris. Hold strong for me. She doesn't complain a lot about tummy issues, so she's pretty good. We've had to deal with a few hormonal things with her, swing inwards, so let's check our piriformis. Big time hormonal muscle. Good on both of those. Pectoralis major, turning this way. Clavicular, going up and out. And sternal going down. I just said that backwards. You all knew that though. That was the sternal, that was the clavicular. Hold strong, we'll do both sides. Good. So she's great with all those. Now she's getting a little shakiness, lightheadedness, that sort of stuff in between meals. Hold strong, let me push down. Spleen 21 doesn't show up on its own, but what could we do to exaggerate that, exasperate that if we wanted to? Anytime there's a blood sugar problem, think about the fight or flight response. There's always going to be adrenaline behind the scenes. So that gluconeogenesis is happening, so the body's making glucose somehow in the fight or flight response. This is also the key, the behind the scenes reason why your patients have trouble losing weight. They're exercising, and I can't get rid of this in the middle. I'm eating hardly anything and I'm exercising a lot. That's what we're going to find with her here, or that you'll find with those patients in just a minute. Probably not so much with Kate. She doesn't typically have a lot of blood sugar problems anymore. So, but we'll see if we can bring one out. I'm going to take adrenaline, epinephrine, and norepinephrine. I'm going to take them both. And just stress out her system a little bit. Just overexcite her body a bit and see what happens. Don't let me push down, Kate. So no problem with that on its own. Let's go back to spleen 21. And there we go. Most of the time, if you know they have a blood sugar issue behind the scenes, you can elicit it, bring it out, if you just stress the body with the fight or flight chemicals. Now, are we going to find spleen 21 in her priority through FBA with our testing? Most likely. If we went through step by step, we would find it. But if, let's say you only have a couple minutes to work with the patient and their primary complaint is shaky, lightheaded between meals, irritability, And we want that point to show up so we can fix that point exclusively. Elicit it, bringing it about. What's another thing that might do it? How about just straight sugar? Straight sugar might do it. Any kind of big-time sweetener might do it. Sometimes caffeine will do it, because caffeine stimulates the fight or flight response. So we just stress the patient and bring it out. And that's a shortcut way to get right to the issue and fix an issue and do her a lot of good, since blood sugar is such a primary problem with everybody. If all you did was find a way to treat the blood sugar system on most of your patients and forget everything else we learned, you would help a whole lot of people.